Since more or less 5 years, we are working on the possibility to detect biomarkers for Alzheimer's disease through a retinal scan. So the idea is to find a different tissue that is out of the skull, out of the brain, and that it's possible to be visualized in order to detect possible biomarkers, possible sign early for early detection, early diagnosis of Alzheimer's disease. We and others already reported a lot of peculiar biomarkers in the retina. So for instance, the accumulation of beta-amyloid, the tau accumulation, but also microglia and astrocyte activation, and vascular pathology. So maybe a real idea could be to have a panel of biomarkers that we can identify. Also because other pathologists share some peculiarities in the retina, like beta-amyloid formations and also vascular pathology. So the idea is to try to find the good set that can be applied for Alzheimer's disease diagnosis, and also to develop probes that can be used in vivo. First, we showed in a mouse model of Alzheimer's disease, and then in retinal tissue from Alzheimer's patients, autopsied patients, we described the presence of hyperphosphorylated tau in the retinal layers, especially in the retinal ganglion cell layers. Now we are trying to use our probes. So we are trying to define new probes, and what I will present today is a new probe that is based on a particular type of molecule that is a BODIPY scaffold that is able to insert into the tau tangles and stick them. So then he has its proper fluorescence, and so we are able to visualize hyperphosphorylated tau, oligomeric tau, using this type of probe. So I will show in this meeting some images that we obtained using iPSC-based retinal and cortical neurons that express in different amount hyperphosphorylated tau, and we used our probe in order to detect them, and we also confirmed the presence of hyperphosphorylated tau and oligomeric tau by co-binding using commercial antibodies. We hope that in the future it will be possible to use this type of tracers in living patients. And also we are working together, a group of physicists that are trying to developing a novel technique for fundus analysis that is based on a scattered assisted imaging, that is a particular type of quite difficult imaging, but that will allow to detect small things at high distance. So because the problem is that if you want to see in the retina you want to use a common fundus camera, you are away from I think 2.5 centimeters. That is too much to have a good sensitivity in terms of dimension.